Thank you everybody for joining us. I'm going to give just a brief overview of what we've been up to in the last year or so. So first of all, who are we? We are one of the oldest patient organizations for ME/CFS in the US, and we provide direct services. Over the last few decades, we've provided direct services to thousands of people. We were established in 1985 and grew out of patient support groups that were begun in 1983. We are a 501c3 nonprofit, and up until this year have been entirely volunteer. We have a volunteer board, and most of our programs are carried out by volunteers as part of committees. Next slide, please. A few years ago, we had a strategic planning process, and we revised our mission statement to be a little more in keeping with what we were actually doing and what we're best equipped to do. So our current mission statement, still a little wordy, but is that we support people living with ME/CFS and their families by connecting them to supportive resources and each other, and by educating and advocating to expand the ME/CFS healthcare and social service infrastructure in Massachusetts. In the process of the strategic planning, we came up with 4 sort of pillars to support our organization, and those are patient support, advocacy, education, and sustaining the organization. So I'm going to tell you a little bit about what we're doing in each of those categories. Next slide, please. So in the support category, so our main goal is to provide services for patients. So people with ME/CFS and fibromyalgia, we focus on Massachusetts, though we do provide information and resources for people in the region and even in the whole United States. We have a contact us line and web form. We get about 220 requests each year for assistance or information. One of our most popular programs is the physician referral service. And so we have a database of doctors who we know are knowledgeable and sympathetic, and we can refer people to them. We also help with disability application assistance. So between the physician referral and disability applications, we work directly one-on-one with about 90 people per year. We also try to connect people to each other. So sometimes somebody contacts us and what they really need is just somebody to talk to who understands. We can provide that. We can also connect people who are in similar situations. For example, parents of children. I was so grateful to find this organization and be able to talk to other mothers who were dealing with the same thing. Over the last year and a half or so, we have greatly expanded our support groups. So this was one of the silver linings of the pandemic, was that we had to move support groups online, and that turned out that they could be accessible to a lot more people. So our support groups are entirely online now, and we've also decided to change the model a little bit. So we're moving away from having sort of open discussion groups and moving more towards having licensed professionals run our groups and having them be a little bit more structured. So there's sort of like a short course on coping with chronic illness. And we have several things that are going to be starting early next year. And the final part of our patient services is to connect people to each other. So we have member appreciation events. We had several of those in the spring. We've put on concerts. We have this annual event. The downside of the pandemic, of course, is this is all virtual, so it's much harder to connect with people, but hopefully in the future, we'll be able to have in-person meetings again and really be able to see people and make new connections. Next slide, please. Under education, so our goal is to educate people with ME/CFS and FM, some of whom have had a hard time finding accurate information, to educate the general public, and to also raise awareness among healthcare professionals. So for education, for information, we have a monthly newsletter that has about 2,800 subscribers. We have a website which has a wealth of information. It does need an update, but we do have tens of thousands of visitors to our website each year. And one of the things that's new on our website is a blog by Nurse Patty Purcell, and she has been writing about children in ME/CFS. We have a Facebook channel and a YouTube channel. These have been reinvigorated by Rebecca Redner, who is a new volunteer who's working on social media for us. Our Facebook page has something like 47,000 visitors last year, and our YouTube videos were watched 33,000 times. So this is very exciting that we can increase the number of people who can access our information. We have events to raise awareness with the general public. When the documentary Unrest came out. We had many events around that. This year we had an author reading of The Puzzle Solver, the book by Ron Davis. That was at Buttonwood Books. We have events to raise awareness with healthcare professionals. We participated in a Invisible Disabilities panel with the Massachusetts Department of Public Health. And we have a grand rounds by Dr. Tony Komaroff coming up at Haywood Hospital in Gardner, Massachusetts. So if you're associated with a medical institution and would like a speaker about ME/CFS or FM, please get in touch with us and we can find somebody who can do that for you. And then finally, we had a publication in a peer-reviewed journal. This was myself and Carol Barish wrote an article about 3 cases of severe ME/CFS in adults, and that was published in the special issue of Healthcare on Severe ME/CFS. Next slide, please. On the advocacy side, we have decided to sort of step back and let other people lead as far as sort of federal legislative advocacy. So Solve ME does a fantastic job organizing Advocacy Day each year. This year, there were 54 constituents from Massachusetts. We met with all 11 members of the Massachusetts delegation. Many of those meetings were led by our association's volunteers who are very experienced with advocacy. Rivka Solomon, the incomparable Rivka, was on PBS NewsHour's Brief but Spectacular with a 5-minute spot about ME/CFS. That video has had more than 1 million views. We participated in the Interagency Working Group on ME/CFS, and we worked with several other organizations to prepare a presentation on barriers to accessing healthcare. We were part of the proposal to change ME/CFS coding in healthcare records. That effort was led by Mary Dimmick. And we're a founding member of the Long COVID Alliance, along with many other organizations. Next slide, please. Sustaining the organization is another thing that we have to do. We rely heavily on volunteers. We have about 35 volunteers who are active. They donate collectively about 5,000 hours per year. That's the equivalent of 2.5 full-time people. We could not do a tiny fraction of what we do if we didn't have all these wonderful volunteers helping us out. We have members and donors, about 300 of them, who support us financially and allow us to provide services. We are extremely grateful. So far, we've been supported by donations entirely from individuals, and we want to look into getting grants to provide our services. So if you know of any family or private foundations that fund the kind of work that we do, we would love to get some tips. It seems to be very hard to figure out who to apply to. This is a pie chart of our approximate expenses in 2021. We spent about half of our budget on the support groups, about 25% on the physician referral and disability guidance, another 20% on advocacy and events, and then 10% on IT and administration. So you can see we're a very low overhead organization. So if you do donate to us, your money goes a long ways. Next slide, please. The board of directors in 2021 is actually quite small, very small for us. It consists of Phil Chernin, who did the introductions. He's the president. Patricia Woods is the clerk, and Susan Buckley is the treasurer. And then I'm on the board as a non-voting ex officio member as past president. Normally, we would be electing new board members at this annual meeting. However, we've moved that election online, and it will take place in November. We are hoping to expand our board, so if you're interested in serving on the board, please get in touch with us. Next slide, please. Looking forward, I think I mentioned we are hiring our first paid staff member. This is a part-time administrative assistant who will start next month. We're very excited about this. We're hoping that this will make things like serving on the board and volunteering a little bit easier for people to commit to if some of the just administrative stuff is taken care of. We want to expand our board from the current 4 to about 7 over the next year and a half. We are looking for licensed healthcare professionals to help with program oversight. We realize we really need to be making sure that our programs are sensible and conform with regulations. And then we've also been working on shifting our support group program from being sort of open discussion to being a little bit more structured. And finally, we're hoping to grow our art share program. This was started by our volunteer coordinator last year and has been very popular. Next slide, please. And I want to thank all of our volunteers. There are many, many people on this slide. I can't name them all, but please know that we just so appreciate your time and energy and commitment to sustaining our association. Next slide, please. I do want to pay a particular tribute to Ann Bodio, who is stepping down after volunteering with us for 33 years. She came in through a support group, served as our information line volunteer manager, has done patient services, volunteered for events. She served on the board for 6 years and then brought in her husband to also serve on the board, and he served as treasurer for quite a few years. Over the last few years, she's been doing something called data mining, where she just looks for articles and information about ME/CFS and then forwards them to a large group of us. This has been an invaluable service. I write the newsletter, and it is so helpful to be getting these little tidbits of information coming at me. So I'm going to end my presentation with a quote from Anne. "Making a difference and contributing to something is very important to me. I have to keep doing things that make a difference. It gives my life a purpose. There is so much you can do from right at home." So thank you, everybody, and I'm going to pass it back to Phil now.
Thank you so much, Leah. I just love hearing about what we do. This is a great organization, and there are many people who've been serving with this organization for far longer than I have, Leah being one of them. I would note that the vast majority of our volunteers are indeed sick with ME/CFS, and this, of course, makes things quite challenging. So all of this work that's being done is being done by folks who are already compromised and struggling, and their dedication is truly awe-inspiring. Thank you for that summary, Leah.